Hi there, I'm Dr. Audrey Tai, board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. In a previous video, we talked about signs of heart disease that can be seen in the mirror or on your eye exam, and I received a lot of feedback from people who wanted to know if there were other diseases that could be diagnosed by looking at your eyes. As a matter of fact, there are. And in today's video, I'll discuss some of the most important diseases that you can diagnose by looking at your eyes. This is the first part of a two-part series where I will cover 20 surprising health problems that your doctor can detect on an eye exam. If you haven't yet seen this video about detecting heart disease with eye exams, you can check it out. Now let's get right to the first 10 of the 20 unexpected health issues revealed by eye exams. Number 1. Aneurysms. Aneurysm is a ballooning of the wall of a blood vessel. This weak wall can leak or rupture, leading to heartaches, strokes, and death. During your exam, your eye physician can detect pressure in the brain, including swelling of the optic nerve or bleeding into the retina, which can be signs of an aneurysm. Number 2. Brain tumors. Tumors causing increased pressure in the brain can affect the eyes. Swelling near the back of the eyes can cause changes to the optic nerve that an eye doctor can see. Loss of sight vision, recent double vision, or changes in the size of a pupil can also be signs of a brain tumor. Number 3. Cancers of the blood, tissues, or skin. A detailed eye exam can reveal various eye cancers, including ocular melanomas, retinoblastomas, and squamous cell carcinomas. In addition, skin cancer such as basal cell carcinoma or malignant melanoma can affect the eyelids and outer surface of the eye. And blood cancers such as leukemia and lymphoma can also affect the eye. Additionally, malignant tumors from the breast or other areas can also spread to the ocular structures and be seen on the eye exam. Number 4. Diabetes. Signs of diabetic retinopathy, such as tiny blood vessels in the retina leaking yellow fluid or blood, can be observed during an eye exam. Sometimes this disease appears in the eye tissue even before a person has been diagnosed with diabetes, allowing for early detection and treatment. Number 5. Giant cell arteritis. Giant cell arteritis, or GCA, is a lingering inflammation of the median-sized arteries that can affect the eyes, resulting in blurred vision, double vision, or sudden vision loss. A detailed eye exam and blood tests can lead to early detection and prevention of blindness. Number 6. Heart disease. As I mentioned in this video, ophthalmologists may be able to detect early signs of heart disease in the eyes, as well as risk factors for heart disease such as diabetes. When the retina is examined carefully using an imaging tool called optical coherence tomography, or OCT, your eye doctor may be able to detect damage to the retinal blood vessels or other abnormalities of the retina, which may indicate a higher chance of heart disease. Number 7. High blood pressure. Unusual bends, kinks, or bleeding from blood vessels in the back of the eye can be caused by high blood pressure, which affects 1 in 3 American adults. High blood pressure is a known risk factor in the onset and progression of cardiovascular disease, glaucoma, macular degeneration, and other diseases. Your eye doctor may notice signs of high blood pressure during a dilated eye exam. Number 8. High cholesterol. If you have yellow bumps called xanthophyll around your eyes, you may have high levels of triglyceride or LDL cholesterol in your blood. A yellow or blue ring around the cornea can also be a sign of high cholesterol, especially in a person younger than age 40. Deposits in the blood vessels of the retina can also indicate elevated cholesterol. Number 9. Lupus. In patients with systemic lupus erythematosus, or SLE, the most prevalent eye-related issue is dry eye syndrome, formerly known as keratoconjunctivitis sicca, impacting approximately 1/3 of individuals. Although dry eyes are a commonly reported symptom, the most critical threat to vision arises from lupus retinopathy, affecting 3 to 29% of SLE patients. Fortunately, the incidence of lupus retinopathy significantly decreases with effective disease management using steroids and immunosuppressants. It is crucial to note that uncontrolled lupus retinopathy can escalate to severe levels, potentially leading to blindness. Your eye physician will be able to see signs of lupus retinopathy on a dilated eye exam, such as cotton wool spots, retinal hemorrhages, and abnormally shaped blood vessels. This findings underscores how important it is to medically manage and control your lupus to prevent you from losing your vision. Number 10. Lyme disease. Lyme disease is an infection spread by ticks, which can lead to inflammation of the optic nerve and an increase in floaters during the early stage of the infection. Early diagnosis and treatment with antibiotics can prevent the persistence of neurological deficits, including permanent vision loss. I hope this video helps you learn more about signs of disease in and around your eyes, so that you can reduce your risk of developing those serious conditions. Stay tuned for part 2 of this video series, where I will cover the remaining 10 diseases that can be detected through an eye exam. If you have learned anything new, please consider subscribing to my channel and turn on the notification bell so that you won't miss any informative content on eye health and surgery. You can also follow me on Facebook, Instagram, and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you for watching, and I will see you in my next video.